The treatment was killing Valerie, and something in Don Mason's gut told him there must be another way. Some place that could provide a true healing solution. Dr. James Forsyth ran such a place in Reno, Nevada.
I was kind of hoping for a bigger building. I know that sounds a little silly maybe, but I'm thinking I just built this guy up to all my people I know, and all I see is, it's a nice clinic, pretty, looks nice, everything looks good, beautiful area, mountains in the background, I would kind of like to see like maybe a hospital or something like that.
I was the only 17-year-old, and everyone else was, most of them were older ladies that had, breast cancer. A lot of them had been sent there because they were end-stage cancer, and the hospital in the area said, well, we can't do anything else with you.
My protocol was to use conventional therapy with complementary therapy. That would be adding some form of alternative therapy to the mix to build their immune system and to assist and aid and be an adjuvant therapy to chemotherapy.
Dr. Forsyth actually took the original chemotherapy protocol I was taking for Ewing sarcoma. He was using the same one, but he shrunk it immensely, where bags were like yay big, they turned to like this big. And I only got chemotherapy maybe 3 times a week, Monday, Wednesday, Friday.
The therapies that we used in the complementary arena were supplements so designated by the FDA. One was called poly-MVA.
The poly-MVA is made out of palladium, lipoic acid, minerals, and vitamins.
Now, as far as mechanism of action, the poly-MVA goes into the cancer cell and creates hyper energy. It super energizes the cancer cell. The cancer cell itself tends to be a very low energy system. The poly-MVA super energizes the cancer cell and in layman's term, more or less fries the cancer cell or electrocutes it because it can't tolerate this excess energy.
Dr. Forsyth also put Valerie on his proprietary formula, the Forsyth Immune Booster. Administered with an IV, it fortified Valerie's immune system by adding vitamins, minerals, and a homeopathic mineral called salicinium.
Salicinium goes after the fermenting properties of the cancer cell. Cancer cells do not use oxygen in their metabolism. They're anaerobic cells. They have what's called anaerobic glycolysis, which means they metabolize the sugar molecule without the oxygen molecule. They use it anaerobically.
Dr. Forsyth used a 1-2 punch when fighting cancer. First, his protocol supercharged the cancer cells to such a degree that they would short circuit. Second, it interrupted the way the cancer metabolized food.
When I instituted this protocol, right away I noticed results. She was leaving the clinic in a spirited mood. She was not sick. She was not having this overwhelming nausea, vomiting, fatigue, malaise. She had a positive outlook, and her parents also noticed right away that she was a different person than she had been under the conventional therapy she was receiving in Texas.
In a relatively short time, in just a few days, Valerie looked better, she was talking better, she was happier.
And after actually 1 week of being there, the cancer in my lungs was gone.
We noticed that her chest X-ray tumor nodules were shrinking in size, and the diameter was going down, the number and size were improving, and in her pelvic area, the large erosive lytic lesion in her pelvis, which was actually eating a large hole in her left pelvis, was reducing in size and starting to fill in with normal bone tissue.
Valerie, in 3 weeks, was practically okay. That doesn't happen in standard medicine at all.
And after a total of 4 weeks, my cancer was completely dead. It calcified. And that was about 8 months ago, so I've been in remission going about 9 months now.